Welcome to Join a Vision Meets, and today I'm going to be talking to Rachel Welsh from Peason Hall in Suffolk. Rachel is a homeopath, a homeobotanical therapist, and a present child translator. And I'm really looking forward to hearing what Rachel has to say about the new homeopathic remedies for COVID. Her son had COVID and a remedy was created. So I'm really looking forward to finding out what that was about. So over to you, Rachel.
I've been a homeopath based in Peason Hall for 10 years now. I sort of got into homeopathy because my daughter, who's now 27, she was born in Hong Kong and she didn't do very well on conventional medicine for ear infections. So I basically, just by chance, joined a course that was teaching people how to use homeopathy for their families. And it was basically life-changing. So my daughter had recurrent ear infections, and as soon as I took her to the homeopath, the ear infections all completely went away. And I sort of got my daughter back because she'd always was really ill on antibiotics. And then I had another child, a son in Hong Kong, and he had homeopathy all the way through pregnancy and childhood. And then I ended up using homeopathy more. So really for about 20 years, we just used homeopathy the whole time. And I decided basically when I was sort of in my mid-40s to retrain, to no longer be a teacher of adults, but to become a homeopath. So I run a practice now in Peason Hall. I sort of specialise really in families. I do quite a lot of support, both psychologically using present child translation, but also quite a lot of homeopathy. And I run 2 free clinics a month where people can access free homeopathy. I run it as a student clinic, so students of homeopathy can come along and watch me work. And during the lockdown we did it on Zoom, but I've just resumed going back to seeing people face to face in the clinics over the last few months, which has been good. But saying that I specialise in children, I actually have, patients from pregnancy through to, I think my eldest patient is nearly 90. So, it's a general practice, but I've got quite a passion for helping with children. During the pandemic, I managed to continue working online when it was the initial lockdown, but pretty much from July last year, I went back to work, got a big garden, and we had an old marquee that we got out of the shed and put up. And so I started seeing people outside, which was great. And my professional body were very supportive, basically said, as far as we're concerned, if you're happy with your PPE, you can just carry on working. So basically, that's what I've done. So I basically worked really since July last year, and I haven't stopped seeing patients, which has been great. We, as a family, had our own brush with coronavirus because my son moved up to London, he's 19, and was having a great time in London and inevitably caught coronavirus. And he's unvaccinated because at that point he was really young, so he wouldn't have been offered a vaccine anyway, and came home with some symptoms. And fortunately that day I had finished seeing patients, and before he was supposed to get up and go off, he's a musician, he was supposed to go off and do a session in London. He was just going back to London, he was just with us overnight. We did just a lateral flow test, and he was positive. So I said, well, in a way that's great, because I quite wanted him to catch it so that he could get natural immunity rather than having a vaccine, because he's got quite a lot of asthma and allergies. And I just felt, for us as a family, and this is not for everybody, but I thought he would probably do better actually being at home. and going through having the virus. Anyway, so he did have the virus and he was at home, and I basically worked with him using homeopathy. He'd been using homeopathy for years and years because he was my youngest. So did you want to ask a question?
I was just going to say, for people who are not familiar with homeopathy, it may be just a word, or they're not sure the difference between that and herbalism, for example. Could you just tell people what
the difference? Yeah, absolutely. Herbalism basically uses herbs in their, I'd say, raw state, tinctures and concoctions and decoctions. I mean, I'm not an expert actually on herbalism, but basically it's where you use the plant either stored in alcohol or you make teas from it. So it's actually the physical plant that you've actually got used in the actual medicines that you use. Homeopathy is different because in homeopathy there is a lot of dilution. So we will take a plant, or we actually use metals, we use chemicals, we sometimes use diseased tissue to make remedies up. We use, for example, a very commonly used homeopathic remedy is tuberculinum. And tuberculinum is a remedy which has been made from somebody who's got tuberculosis. So it's the sputum from somebody with tuberculosis. And that remedy is diluted many, many times. When it goes through the dilution process, what happens is there is no material left in the remedy. The remedies are made up using water, and then they are basically distilled and kept in alcohol. There is no actual material dose left. So what we're doing with homeopathy is we're tuning into the energy of a substance, and how that energy resonates with your energy is where the healing will start. So it's really good for people who don't do particularly well on conventional medicine. There are some people out there who really react to pharmaceutical medicines. I'm an example, my son is an example, and many of my patients are. It's not that pharmaceutical medicines are not good, and they can be extremely helpful and absolutely life-saving, but for some people, because of the way they cause a lot of side effects. So with homeopathy, what we're aiming to do is we're tuning into how your body is responding to the world. And we choose a remedy basically by looking at what your symptoms are, and we choose a remedy which has been made from a substance, a plant, a flower, whatever, in nature. And if you were to ingest that substance, what symptoms would come up? So for example, a really simple example is onion. You know, when you cut an onion, your eyes run and your nose runs, and some people start sneezing. So if you are going through a hay fever season and your eyes are running and your nose is running and you're coughing, what we will do is we will look at the list of all of the research that has been done on people who have been given a homeopathic version of onion, and we will match your symptoms that you're experiencing with hundreds of years of experience of people all across the world who have had those similar reactions and have been given onion as a remedy, and we'll work out whether or not that will actually make you better. So that's really how it works. What we're doing is we're looking at you and what your symptoms are, because everyone's hay fever is slightly different. Some people sneeze and cough. Some people actually get very blocked up and they can't blow their nose. Some people actually don't get any sinus symptoms with hay fever. They just get really weird skin rashes every time it's hay fever season. And it doesn't mean that it's not hay fever. In fact, you're not sneezing. It's your body's reaction to pollens. So there'll be different remedies. So for example, if you're going to get lots of sneezing and coughing, you probably would possibly do well on the remedy made from onion, which is called allium cepa. But if you're getting lots of skin rashes, you may actually do much better with a different remedy, which is a remedy that if you were to have that particular material in real life, would give you a skin rash. So there are thousands of remedies. I've actually got my book here. This is what we call, this is a Materia Medica. And you can see it's very thick, it's a bit like a Bible. It's got absolutely hundreds of remedies in here. And that has a list of all of the symptoms. And what we use to be able to choose the right one for you is what we call a repertory. And you can see here, it's just a book and it's got lists and lists of symptoms. And so we go through your symptoms and we work out for your hay fever or your cough or your period pain, whatever it is, what's really specific to your experience. And then we cross-reference the list of your symptoms with a list of remedies that have been used for over 200 years by many, many, many people. And we basically match you with the right remedy. So that's basically how homeopathy is quite different to herbal medicine. Herbal medicine still has the same idea that there's a materia medica and that, there's lists of symptoms. But what we're looking at with homeopathy is how you energetically are matched to any substance in the universe. Basically, we use lots of things. We use metals, plants, we use sunlight, moonlight. We also use nosodes, which are basically remedies which are made from diseased tissue. We use sarcodes, which are basically remedies made from healthy tissue. So we're trying all the time to look at how you are as an energetic being within the world and to match your symptoms with a remedy that will get you back into a healthy energetic state. Does that answer your question?
Yes, that's great, because I think a lot of people don't know what homeopathy actually is, although they've heard the term. So I think that really clarifies it for people. So back to your son. Sorry, I was cut you off there, but I just thought we need to know what homeopathy was. So
so basically, he came back with coronavirus, and he was home, and he'd already been taking some homeopathy in London to keep his immune system up. His symptoms were really mild. He didn't really get a cough, which I was quite relieved about because he's asthmatic. But he did get muscle pain and he felt very weird, he said. Had ear pain, which is interesting because he'd had a ruptured eardrum about 18 months before, so it was a bit like it went to a weak spot for him, which I have heard. People have said wherever you've got a weak spot, sometimes it's where coronavirus sometimes gives you more trouble. And basically I work with homeopaths all across the world, and one of those homeopaths basically runs a pharmacy in London. And I spoke to him and I said, he was saying, I really need to collect a sample from somebody who has had a recent infection of coronavirus, because I'm looking for a Delta variant. I mean, we don't really know how scientific all the variants are, but anyway, somebody with a recent infection, because he wanted to add this to the nosodes that he'd already got that had been collected from people who had actually had active coronavirus. So my son agreed, said he was happy to do it. So my job was to collect some of his sputum and to send it to London. And from there, it's been made into a remedy, which you can purchase. What I'll do is I'll give Venetia the details once I've checked with the pharmacist, if that's okay, I'll do that. But basically, homeopaths will know about nosodes and they will know about where to get a specific nosode that will match your symptoms, either for coronavirus or before coronavirus, or if you have long COVID, the nosodes can be really, really helpful. So basically, yeah, my son's basically has been instrumental in creating a new remedy. I use that remedy a lot in my practice. I use it mainly at the moment prophylactically, and prophylaxis is another word for preventative, basically. So quite a lot of my patients, I've got a lot of patients who are vaccinated, and that's fine, but some people choose not to be vaccinated, or they would like to supplement their vaccine state with also homeopathy to support their immunity, basically. And so I will use, if it's appropriate, a nosode, either one made from my son, or there's 3 others which have been created since the virus hit the world. So, you know, there's real options there for people. We would recommend as homeopaths that if you're going to use nosodes, you need to see a professional homeopath, because you need to understand what you're doing. But it's a very useful tool in the box for creating a healthy response in the middle of an epidemic in advance. And it's also really useful for people who may have had coronavirus and are suffering from long COVID. So they're just really a useful tool in the box. I mean, homeopathy has a very long history of working through many, many epidemics and pandemics through the world. And we also use combinations of remedies which have been useful and used, you know, for many flu, like Spanish flu, for example. I mean, homeopathy was certainly around with Spanish flu. So there are many things that people can do themselves without consulting a homeopath. You can purchase homeopathic remedies from Helios or Ainsworth's, and if you speak to the pharmacy and you talk about your symptoms, they'll often give you advice online. It is limited to often acute situations. They will always recommend you go to see a homeopath for long-term chronic illness, especially something like coronavirus, which, you know, is something that we're all dealing with at the moment, and we're not allowed to recommend that you don't seek other medical advice. But if you're at home and you are just wanting to boost your immunity, there's nothing to stop you calling the pharmacies and asking for advice. Yeah, I mean, basically, homeopathy can be used on many, many levels. You know, my introduction to homeopathy was because my daughter had ear infections and didn't do very well on them, and I learned about homeopathy and I went to see a professional homeopath. So that was my route into homeopathy. You can purchase homeopathic books to learn about how to treat your family with homeopathy. The great thing about homeopathy is that it's fundamentally very safe because it's very dilute. And the thing with homeopathy is it will either work or it won't. It's very unlikely to give you side effects. We always say that it's best to consult a professional homeopath, because if you do take a remedy for a very, very long time, again and again and again, you can sometimes cause what we call a proving, which is you will actually begin to manifest symptoms of that remedy that you didn't have before. So with my patients, I keep a very close eye on them and monitor them and make sure that they're not taking a remedy for, you know, a long time to create other issues.
How long would
but it's not time? Sorry,
how long would be like a long time?
Oh, I'd say probably 2 or 3 months.
Right.
I'd say a long time. Any more than that, you know, I would, if you're taking a remedy every day for 2 or 3 months, it needs to be monitored, really. But if you've got something like a cold and a cough and you look in your homeopathy book, which you can buy very easily, and you contact the pharmacy and you take a remedy, you know, for a week or a few days, that is fine. I mean, that is going to, you know, help your body. And if it doesn't, then you basically just go back and look through the book again and just get yourself educated about how to use homeopathy. Homeopathy is great with babies and children. Helios have quite a lot of what they called combination remedies, which are remedies which are made for things like childhood fevers or stress. Also, there's one for strains and sprains, and they are really useful because they are what we call low dose, which means that not a high potency, so very gentle. And there's instructions on the back about how to use them, and I know they're readily available to anybody to buy. But
so you were saying like that each person has, for example, like your son had certain symptoms when he had coronavirus. So would the remedy which has been created from him, what was like would be like the picture for that
him?
The remedy? I mean,
yeah, that's a really good question. What we're doing at the moment and what the pharmacy is doing is actually collecting a lot of information about the people who are doing well on that particular nosode, and what symptoms seem to improve with it. The biggest problem, of course, we've got when we're in the middle of a pandemic is that we just have to get on with it. A bit like we've seen, you know, with the whole vaccine program, really, people have just got on with doing something. And this is how homeopathy has always been. Homeopathy has always been a process of actually working with remedies and keeping really good medical notes about what symptoms have really improved and how people have improved, not just on a physical level, but also an emotional and a spiritual level as well. So the answer to your question is that at the moment, what we're doing is gathering information. So far, because my son is quite young, and he has a lot of energy, and he's very artistic. We'll probably find over the years after we've been using this nosode that will be a remedy that may well resonate with that type of person.
So right.
But we don't really know that yet, because at the moment we're in the middle of it. So we're basically just gathering information, and we're monitoring closely. And that is one of the things that homeopathy is really good at. We're really good at keeping good notes about our patients and monitoring the whole time about how they are actually energetically changing. And so it will be really interesting to see how that pans out. In homeopathy, we tend to look at epidemics and pandemics very holistically. So we would be looking at not just what happens when somebody catches coronavirus, and do they get a cough, do they get a cold, do they get pneumonia? I mean, obviously it's a very important part of it, and we would treat for whatever the person presented with. But we also look very much at what does coronavirus and what has this pandemic actually meant for us energetically in society. So what we're looking at is fear. The vast majority of people in this country are just very fearful. They're either fearful, that they're going to catch coronavirus, so they want a vaccine not to have it, or they're fearful that if they don't have the vaccine, then they may be affected by people who have been vaccinated. So there's a lot of fear which is around this whole pandemic. So we will be looking very much at how do we help people with fear? Because if you're very fearful, you're much more likely to get sick, because your immunity is going to be depressed, because your adrenal glands are up and you can't heal. If you're full of fear, I mean, if you think about, if
yes,
if you fall over and break your leg and you're lying under a hedge and you think you're going to die of cold, it's not going to do your broken leg any good. It's not just that you're not being looked after and that you're not being put in a cast. Actually, the energy that your body needs to heal the leg is not going to be there because you're scared. So a huge amount of what we do as homeopaths is we recognize that not only has somebody got a cough or a cold or eczema, we're looking at why is this person not healing? What's the bigger picture here? So this is exactly the same with the pandemic. We're looking very much at things like the nosodes, which is, what is it about, this particular disease that actually keys into a person on an energy level, on an emotional level, on a spiritual level? So, for example, tuberculinum is a remedy that homeopaths use the whole time. And a lot of people with tuberculosis, they were very creative and very artistic and very sensitive. For example, practical things, that they did much better in the mountains. They do much better with cold air. So, all the TB hospitals are often up in the mountains. So, if somebody comes to see me and say, well, I've had this really bad cough for years and years and years, and I say, well, what makes it better? So, when I go skiing every year, I'm so much better. So this is a really good example for me that, this man may not have tuberculosis, but I would still give tuberculinum as a remedy, because I'm matching what's happening with this person in terms of when they feel better in the mountains. They love travel. That's the other thing with tuberculinum as a remedy. Often people who got tuberculosis were great travelers. They, not travel like we have, but if you think back in Victorian times, there'd be people who would really want to go to the country or go to that, or they'd be more likely to travel and want to travel. So that's a good example of what we're looking at when we're looking at any remedy, but also particularly nosodes. It's not just about treating you for your physical symptom, it's about treating you for your spiritual and your emotional response. And when I say spiritual, I'm not talking about particular religion, or
no,
it's more who you are as a person. And spirituality is being in nature, or being with horses, I don't know, whatever it is. It's whatever makes your spirit, keys into your spirit. So that's what we're really looking for. Does that answer your question?
Yes. I'm just thinking, you were saying about with the what is the underlying thing with the pandemic and fear being such a topmost issue, but there are many different fears, and underneath all those fears is probably the fear of death, or the fear of death.
Absolutely.
So would the remedies be kind of looking, would there be like a whole section of remedies for the going down the different levels of fear? So like, as you said, first fear could be fear of losing a job, then it could be fear of being in hospital, then it could be then
absolutely
the fear of death itself. So would there be different levels of remedy for all those fears, or would you go straight to the fear of death, which I presume there's
no, you would just do a really careful case take. So, I could talk to maybe 5 people all in one day, all with coronavirus, and they'd all have different fears. So there may well be somebody who's absolutely terrified they're going to die. And then there's a really good remedy for that, which is aconite. Aconite is classic, old remedy. And the keynote with it is fear of death. So that would be a really simple example. Somebody is very fearful of dying. They may well have lots of other symptoms that would be, very accurate for aconite. They may feel worse at midnight. They may be short of breath. They may go hot and cold a lot. All these things would be aconite type symptoms. So I wouldn't just be looking at fear of death. I'd be looking at other symptoms. I'd be looking for at least 7 symptoms to match to me to say, okay, let's give you some aconite. There's another remedy, which is arsenicum, which is made from arsenic, basically. That's got a fear of death as well. But that's got a fear of disease, and it's got a fear of dirt. It's also got a massive fear of
dirt. Yes.
Yeah, it's also it's got a massive fear of losing your income. And there's a lot of control with arsenicum. Arsenicums want everything tidy and neat. So there may well be somebody who might have fear of death, but they will also be very worried about losing control and losing their income. So that's a good example. You know, there are so many different levels of fear that we would look at. So, you know, another person who you might give a remedy like belladonna. Belladonna's when you get very, very high fevers and lots of like hallucinations. So they may be really fearful, and they may be hallucinating that the room is on fire, for example. And they could all have the same, exactly the same virus, but they'll manifest it in a slightly different way. One of my children got really very, very high fever, and he was, you know, basically delirious, and he thought that the chair in the middle of the room was on fire. And my older daughter was absolutely terrified. She said, "Oh, Mum, he's gone mad." And I said, "No, he's not gone mad. He's just got a very high fever and he's delirious. And you know what? That's fine, because he just needs to basically work through the fever." And we gave him belladonna, and you know, it will calm down. So, you know, that's another fear, but that's a fear that would come from, you know, basically having a very high fever and being delirious. So, and there could be other remedies. You know, there's another remedy, pulsatilla. Pulsatilla is a fear of being on their own. Really don't want to be on their own. Don't want to be left. So, you know, that's another really good remedy that we would give for somebody who had flu. But they would have other symptoms. So they may be very snotty. They may be crying a lot.
Yeah.
So yeah, you're right. There's all different levels of fear. The pulsatilla fear, they might be afraid of death, but that's not going to be the main thing. The main thing is about being on their own. They really don't want to be left on their own.
I see.
So it's quite, I mean, you know, to train to be a homeopath, it's 4 years of training. And I'd actually say it's 5 years, really, by the time you've actually done your training and you've also done your portfolio and you've seen enough patients. So I'd say it's a 5-year program of training. And, you know, it's great home prescribing because there's some really good books out there, and you can certainly help you with acute stuff like colds and coughs and strains and sprains. But the really deep stuff, you know, where we're looking at homeopathy as really offering an integrated health care plan, you need to see a professional homeopath, because we're looking at your history, we're looking at what medications you're taking. And again, I've got no problem with people come to see me who are on medications, pharmaceutical medications, work with them the whole time. And pharmaceutical medications can be really good for some people. They really do help them. But what we're looking to do is we're actually looking to work really closely with people's medical choices and just supporting them to help their bodies deal much more effectively, so that we're promoting a really high level of health and a really good level of, you know, sustainable health. You know, people just don't want to be hindered by the health choices they make. They want to be able to access the positives in any medical intervention that they have, whether it's an operation or whether that's pharmaceutical drug. So I mean, I see it very much, homeopathy is a very good integrated health system, because it looks at spirituality as well as emotional health as well as physical health. It's very safe, and with a homeopath, you're going to have a very good chance of really boosting your immunity to withstand anything, whether it's a pandemic or whether it's a shock or a loss or a bereavement. It doesn't really matter. We're looking at really underpinning your health.
What I know you practice the batch flower remedies as well. You provide that. Yeah. Could you explain to people a bit what the difference between how a traditionally produced flower remedy is in comparison to homeopathy, because I understand some of the flower essences now are made homeopathically, but that's not necessarily how they were intended initially.
Basically Dr. Batch was a really interesting doctor. He basically worked in gastroenterology for a bit, and actually he did quite a lot of research at the beginning of his career into using basically fecal transfer to promote health, which really interestingly is now used in the hospitals today. People who have got antibiotic resistance, they actually sometimes take bacteria to help promote the gut bacteria. So it's old medicine, really. So that was his job at the beginning. Basically, he worked with that, and then he actually got involved with the London Homeopathic Hospital doing some research, and then he changed the work that they were doing using basically diluted poo, really, and made it used homeopathy to make nosodes, basically, which is what we use all the time. So from poo, but basically it's basically the bacterium in the gut, which we are really sort of specifying and making into a remedy. So quite a lot of people buy acidophilus off the shelf, because Phenibacteria is exactly the same thing. I mean, it's basically a bacterium that the gut needs in order to be healthy. But in homeopathy, we prescribe it very specifically to somebody who is experiencing not just particularly gut issues, but it may well be period pain, or it could be anxiety, depression, it could be skin problems. And if you think of Phenibacteria as being like really broad spectrum, and the bowel nosodes as being much more specific, we're really matching that bacterium. If it's not in the gut, will start to manifest certain health and emotional issues. So we're trying to match that. So that was the early part of his career, was basically working on really helping to promote gut health. And it's very, very well recognized now. Probably in the last 10 years, people are beginning to recognize that a healthy gut is actually the key to long-term health. So that was his first part of his career. But then he actually became very interested in what made people unwell in the first place. And he began to see that a lot of ill health came from emotional strain and stress. So he basically started working using flowers, and either preparing them by collecting flowers and putting them in water, and basically allowing the sun to soak, be part of the process with water to make the remedies. And then basically what was he collected from the flowers being out in bowls of water in the sun, and then preserving them in alcohol. He actually was quite a real meditator, a bit like a shaman, really. He could actually sit by flowers or trees or whatever, and he would feel what that flower or tree could actually do, and what emotional state that would really support with. So he came up with basically 38 remedies over many years. Most of them are made, either they're left in the sun, or they can be boiled and then made into flower essences. So that's what you will buy if you buy a batch flower or a sun essence flower. That's basically the flowers that have been made, or the trees that have been that essence has been made in that way. The other way that you can make flower essences, I actually use what we call a radionics machine, which is a machine which has frequencies that you dial into the machine. And through using the radionics process, you actually are given a rate which has been dowsed, and that rate will resonate at that particular level of that flower essence. I use them sometimes. I use that way of making remedies for people who don't want to have anything in alcohol. So that could be for children, or it could be for recovering alcoholics. They can't have even the flower essences in a little bit of alcohol. So I do sometimes make remedies up using a radionics machine. So that would be, for me, how I would make a homeopathic version of a flower essence. They work perfectly well, exactly the same way as. And it's all about you. I mean, I think for quite a lot of people, it's getting your head around the difference between energy medicine and more, when I say pharmacological, more actual material dose. And for some people, that's a really difficult. It's just a very difficult concept. But it's not a concept that's very particularly respected within our world. We have, the vast majority of our healthcare is based on pharmacological approach, for whatever reason. Don't want to go into why that is, but that is what we have. And I'm not saying it's a bad thing. I think for lots of people it works extremely well. And I work with people the whole time who are on conventional or herbal medicines or taking nutritional supplements. I mean, I'm not anti anything. I think people have to make their own health choices. But, I'm here for the people like my daughter who just don't get on with conventional medicine. There are a lot of people for whom it's not an option. Their levels of health are not good, and they do need another option, and that's my job, really.
Did you said you used to live in Hong Kong, but you weren't. Did you do homeopathy?
No, I wasn't.
Whether you noticed a difference in particular remedies which were needed in Hong Kong. I knew a healing teacher who was a teacher in Hong Kong, and then when she came back to Britain, she was amazed at the difference in the energy fields of the people in the West to the people she'd been treating in Hong Kong. And I wondered if you'd come across that.
Not as a practitioner, because when I lived in Hong Kong, my kids were really small and I was teaching then. I mean, I've always practiced in the UK, so it's a bit hard for me to know as a practitioner about the shift in energy. What is really interesting is talking to people who I know have gone to somewhere like India, and they've maybe gone to train with a Indian practice, and they see a lot of patients there. It's a very different type of prescribing. There's a very respected homeopath who's done a lot of work in Africa with people with AIDS, with really good responses. But again, very integrated. They work alongside conventional medicines as well. It's not just homeopathy. And yes, it's a very different type of prescribing. I mean, my experience in the UK is that the type of prescribing we do is a lot about how people are emotionally and spiritually wanting support, because that is the world we're in. I'm not saying it's a good or a bad thing, but there's, we used to have, the church used to be a massive part of people's spiritual landscape. And your GP would be, the priest and the GP would be where you went, either to talk about your sins or to.
Well, they had the fact they were family doctors. Yeah,
your family doctors. They knew who you were, and they knew who you, not only know who you were, they knew who your grandmother was as well. So there was a real sense of connectivity, and I'm not saying it was perfect. I'm sure it was not perfect on many levels, but there was a simplicity about, if you were sick, you went to the family doctor, and if you spiritually had a question, you went to church, and that was sort of it, really. Now, of course, all of that old system has been completely blown to pieces. I mean, church is not a massive part of the fabric of society now. I mean, I'm not saying people don't go to church. I'm not saying it's a good or bad thing. This is not at all judgmental. I'm from a religious background, so I'm not anti-religion or anything. But the reality is that Sunday used to be going to church. I mean, I don't know how many people you know who go to church every Sunday. It's not such a big part of a spiritual landscape. So I think when people are coming to see a homeopath now, or whether it's a homeopath or an osteopath or a kinesiologist or an acupuncturist, sure, they're coming, of course they're coming for physical stuff, but I think they're also coming because they're looking for emotional and within reason. I don't know, different practitioners work in different ways and different disciplines have different viewpoints. But I mean, I know many people who go to osteopaths who are very spiritual people. And I know people who go to chiropractors and then they're not interested in anything to do with spirituality, just want to make you feel better and your back feel better. So yes. I think people are beginning to be drawn now more towards complementary, alternative, whatever you want to call it, health, not just because they want to get their knee better. I think that, you know, the role I've seen, certainly over the 10 years that I've practiced, is that, you know, you do begin to become a bit of a cross between a priest and a vicar and a doctor, because people are looking for that sort of support. And I think that has been exacerbated by the pandemic because, you know, the NHS they just can't offer that. No. They just can't offer that. And that's not a criticism. I mean, you know, they're dealing with a lot of stuff. I mean, they don't have time. They don't have time to talk to, you know, Mrs. Smith about the fact she's upset because her cat died. I mean, they just don't have time for that. And, you know, that fair enough. But, you know, complementary health or alternative health or integrated health, which would be a nice way of looking at it, is looking at, yeah, okay, well, and everything got worse after your cat died. So, you know, what was it about the cat dying that was so bad? And it's like, well, you know, the cat saw me through the pandemic and now the cat's died and, you know, I don't have a reason to get up in the morning. You know, this is really, really, really important to us. As complementary health therapists. This is probably the crucial reason why they're sitting in the room. It's not because their knee hurts. Yes. It's because they are chronically grieving for their cat. And, you know, that is fine. I mean, that, you know, absolutely, if that cat has seen you through the pandemic, it's going to be a massive loss. So we would be looking at that as being a very important part of your program. But if you go to Ipswich Hospital saying, actually, you know, my knee's never been right since the cat died, they're like, they don't care about the cat. They need to get you scanned and they need to find out, you know, what's going on with you, which is also really helpful, but it isn't probably going to solve the problem on its own. You need you know, again, that thing about, you know, if you've broken your leg and you're laying underneath a hedge and you think you're going to die of cold, your knee's not going to get better because you're too stressed.
You were saying earlier about integrated health, and I believe you are involved with mainstream and complementary, bringing together a new model where both sides could be working alongside more and, you know, much more compatible than it's been in the past. Would you like to share something about that?
Yeah, no, I really welcome the opportunity to just work alongside conventional health, really, because I think we can do a lot of the tough leg work, you know, the sort of emotional aspect of why people get sick, and save time for the NHS to do what they do really, really well, which is, you know, emergency medicine and surgeries and, you know, looking at chronic ill health and trying to work out which medications work best for that. If we can work well helping deal with side effects and also more of the emotional aspects, and helping people to feel empowered about their health, because I think that is one of the things that quite a lot of my patients say that they find helpful when they come to do homeopathy, is that we just try and step back and put everything to perspective. I do quite a lot of work with cancer patients, and I don't have any cancer patient that isn't doing conventional cancer treatment as well. Absolutely fine. But sometimes when you get a cancer diagnosis and you just get told you've got to do this, you've got to do that, this is the best thing, you feel very disempowered. There's not much control there. You just sort of do as you're told, because that is really, it's an emergency, so you just sort of do as you're told. And I'm not saying that's a good or bad thing, but I think what's really important, what we do, is that we help people work with that, and we help people to visualize the positivity of what they're taking, whether that's chemo or radiotherapy or whatever. And it's about actually really working with people and saying, okay, well, look at this as just part of the pie chart of what you're doing. Sure, your radiotherapy or your chemo is really important, but also your spiritual self, your family and support, your exercise program, what you're eating, how you're viewing this whole process, what your cancer journey's brought up for you in terms of what's really important in life, what you maybe need to change, who you need to talk to. Perhaps you haven't talked to some people for many, many years that perhaps you need to talk to, or maybe you want to stop talking to some people who are dragging you down. I mean, it's a really holistic.
Empowering.
Yeah, I mean, I did a lot of training in the Penny Brohn Centre, which is an was, I don't know if it still is, but it was an NHS funded place. And the Penny Brohn Centre was very much about this. It was about, helping to integrate.
Where is
in Bristol? It's in Bristol. Yeah. It's very much about integrating your conventional care into a bigger framework about who you are as a person and how you're going to get better using those as part of the pie chart, not the only thing that's going to save you. And they pretty much conclusively found that people who looked at it more widely, did more meditation, more visualizations, felt as though they were in control, felt like they were doing appropriate exercise, had good family support or supportive friends or whatever, were the people who got better.
I think people are changing, aren't they? There is more for crossover now, and if the pandemic's done any good, it's part of that is this empowerment for people.
Absolutely. I mean, people just got to make choices about informed choices about what is right for them, and to be surrounded by professionals who are respectful of their choices. I mean, that's where I'm coming from, really.
People who have had the thing in the arm, and maybe experiencing side effects. I read somewhere or other, I think it was another homeopath speaking, saying that particularly with the Pfizer, that homeopathy couldn't help because of this the particular technology of that thing. Have you experienced? What's your take on that?
My take on that is, I think it's very early to tell.
Well, exactly. Yeah.
I don't think we really know yet. This is my belief system, and not everyone has to agree with me. I mean, everyone has their own choices. I inherently believe that we all have an ability to heal, and that's absolutely fundamental. And that is all. It doesn't really matter what has happened or what has been put in you. You can connect with, I mean, I sometimes call it like the matrix, probably not a good word, but there is absolutely, that your body can tune into. And I think the biggest barrier to that is fear. So if we can help people to stop feeling fearful, they can actually start to connect with whatever they need to do to heal. So whether they've had jab in the arm or not, to me, I don't really care, because what my job is to reconnect you on whatever level that is. And I mean, I'm not going to start making claims that I can cure anything. I can't make any claims. No one can make any claims about that. And I would be struck off if I started saying I can't cure anything. And I'm not claiming to cure anything. But what I can claim is that my job is to listen to you and to help you rebalance so that you can actually integrate your physical, spiritual, and emotional self on whatever place you are on that journey and whatever you've done in the past to your body. And I feel really very confident about saying that, because no one can really say that that's not true.
No,
because, you know, I have patients that just keep coming back. So as far as I'm concerned, I must be doing something right, because they wouldn't be coming back if they didn't feel, and they've got to pay to see me. It's not free. You know, people are not going to do stuff unless they feel it's actually benefiting them. I don't know, does that answer your question?
Absolutely, yeah. And it's a lovely way to wrap up, I think. You're helping, empowering people to whatever.
And it's about making informed choices. Yeah, it's about an informed choice. If people make an informed choice, whatever choice they make when they walk through the door, my job is not to judge them. You know, whatever they choose, it's, you know, it's not my job, just like it's not anyone's job to judge me for the choices I've made. And, you know, I'm just here to serve, really.
Wonderful. Anything else you'd like to add?
No, just thank you for asking me to come, and good luck. Hope it all goes well.
And we're all wishing each other luck, and no fear. Feel the fear and do it anyway.
Yeah, just don't go to the fear. Just when you feel fearful, just get your feet on the ground and just don't be fearful, because that's what will depress your immune system more than anything else.
Wonderful. Thank you.
Okay.
Thank you.
All right. Take care.
Bye.